Hey everyone, if you're getting ready for knee replacement surgery, you might be feeling a mix of excitement and nerves. I'm here to help you get fully prepared so that your surgery and recovery go as smoothly as possible. Hi, it's Steve from MyColdTherapy and Supply Cold Therapy, where we help people get back to living. If you're new here, make sure you click that subscribe button and all the links to everything we mentioned in this video that you can find linked in the description box below. Now let's jump right into it. Step number 3, understand the recovery process. Immediate post-surgery recovery, your hospital stay. Expect to stay in the hospital for 1 to 3 days after the surgery, depending on your overall health and type of knee replacement. During this time, your medical team will monitor your vital signs, manage your pain, and begin early mobilization to promote blood flow and prevent complications like blood clots. Pain management. Pain is a normal part of the recovery process, but will be managed with a combination of medication and cold therapy. This may include oral pain relievers like opioids for short-term use and non-steroidal anti-inflammatory drugs like NSAIDs. Nerve blocks or regional anesthesia may also be used to provide pain relief to the knee area for several hours to days after the surgery. Early physical therapy. Physical therapy usually begins within 24 hours of the surgery. A physical therapist will guide you through the gentle exercises designed to start regaining motion of the knee and strengthening the surrounding muscles. Initially, you may use a continuous passive machine which gently moves your knee while you rest to prevent stiffness and improve blood circulation. This is going to be up to your physician on what they use. The next one is the first few weeks at home. Your mobility and your daily activities. You'll likely be discharged with a walker or crutches to assist with mobility as you gradually start putting weight on your new knee. Basic activities such as getting out of bed, using the bathroom, and dressing will be challenging at first. However, occupational therapists can offer strategies and tools to help you manage these tasks independently. Follow the prescribed weight-bearing restrictions to avoid complications like loosening or dislocation of the implant. Physical therapy and exercises. You'll continue your physical therapy several times a week, either at home or in an outpatient facility or through a combination of both. PT focuses on a range of motion, strengthening the muscles around the knee, and gait training. Home exercises prescribed by your physical therapist are crucial and should be done regularly to maximize your recovery. Swelling and discomfort around the knee is normal and may persist for several weeks. You want to manage this by elevating your leg when resting, using ice packs or cold therapy machines regularly to reduce swelling and pain, and wearing compression stockings to prevent blood clots and to manage the swelling. Discomfort, including stiffness and soreness, is common, especially after physical therapy. Over time, as your knee heals and strengthens, these symptoms will gradually improve. And then we have something called the midterm recovery, which is 1 to 3 months. And you're going to be increasing your activity levels as you progress. Your physical therapy will introduce more challenging exercises to improve your strength and flexibility and endurance. You may begin incorporating low-impact activities such as stationary cycling, swimming, or walking on a treadmill into your daily routine. These activities are excellent for maintaining cardiovascular fitness without putting excessive strain on your new knee. Resuming your daily activities by this stage, you should be a little bit more independent with daily activities, and you may begin returning to work depending on the job that you have. Sedentary jobs may be resumed within 6 to 8 weeks, but please consult your physician, while more physically demanding work may require 3 to 6 months. Driving can usually be resumed once you comfortably bend your knee and are able to operate the pedals, typically around 4 to 6 weeks post-surgery, provided you're not taking opioid pain medication. And again, any of the above is 100% physician-driven, so please ask the doctor and their staff. Then you want to be monitoring your complications. Be vigilant for signs of potential complications such as infection, redness, increased swelling, warmth, or drainage around the incision site, and blood clots, unusual swelling in the calf or thigh, warmth and pain. If you experience shortness of breath or chest pain, seek emergency medical attention immediately. Now your long-term recovery. This is 3 to 6 months and beyond. Full recovery from knee replacement surgery generally takes about 3 to 6 months, although it can take up to a year to achieve a maximum improvement in strength, flexibility, and function. Most people experience significant pain relief and are able to return to normal activities, including recreational activities such as golf, cycling, tennis, and swimming, although high-impact sports are usually discouraged. Continued physical therapy, even after formal physical therapy ends, is important to continue the home exercises to maintain the strength and flexibility in that knee. Regular physical activity is the key to long-term success of your knee replacement. The next thing you want to check into is lifestyle adjustments. You might need to make some long-term adjustments to protect the new knee. This includes maintaining a healthy weight to reduce stress on the joint and avoiding activities that involve high-impact movements, twisting, or heavy lifting. Monitoring the implant. While knee implants are designed to last many years, regular follow-up appointments with your surgeon are important to monitor the condition of the prosthesis and address any issues that may arise over time. Now that you're better prepared for knee replacement surgery, we invite you to subscribe to our channel and like our videos. Your support, at no cost to you, helps us continue creating valuable content that assists individuals in returning to an active and fulfilling life. Now please make sure you check out all the videos in this series, and let's get back to living.